Hi, everyone, and welcome to this module on cost. There are two summary articles to read. I'm going to be referring to both in this short YouTube lecture. In fact, I've taken screenshots, excuse me, of a few things that I'll be highlighting. I would like you to, if you wouldn't mind, is go through each of the articles. The first one is a little more dense. It's from Health Affairs. It goes through the cost of healthcare up to the end of 2023. The second one is a shorter from Narrative Matters. Reading those first, you'll have a context of your own before you listen to this. And then, of course, at the end, you can try out the quiz. There's a separate YouTube video about quizzes. So let me talk about this. This update and this type of article where it looks at trends in national healthcare expenditures comes out every January for the preceding second year, meaning it came out in January 2025 and it goes up to the end of 2023. So those are the numbers we have right now. Let's start with it to look at a very uh, macro perspective on costs. Um, What we have here is insurance, Exhibit 2, private, Medicare, Medicaid, and uninsured. It is the vast majority of insurance in this country. You can see from 2017 to 2023 where we are. What you can definitely see is growth in private insurance, growth in Medicare, mainly attributed to growing demographics, growth in Medicaid, and that's through expansion of states. And of course, a decrease in the uninsured population as well. So if you just look at expenditures, and then of course you can look at the actual enrollment, it really does tell a story. The fastest growing group, or at least the group that has the most impact, is private health insurance. And that's because there are certainly, as many of you might know, many Medicare and Medicaid plans that are in the private market as well. So that is really an interesting part to understand big picture of where costs are divided. Now, I like to point this out, and when I use let's see what color this is, see if this works. If we just look at Medicare, no, let's not do that. If we just do Medicare and Medicaid, government insurance programs. Together, now we know there's 50 Medicaid programs, essentially one Medicare program. If we add those expenditures together, we're almost at, well, we're at a lot, right? What are these in? My gosh, these are in billions. So, okay, so we're into the trillions here. Um, the I'd like to point out we absolutely have government funded healthcare in this country. We have private funded healthcare. So it's right there in the numbers. Um, and the government funded outweighs the private market just in terms of expenditure. So it's a cost perspective that shouldn't be lost on anyone. Let's go a little bit further and look at Exhibit 3. Exhibit 3 breaks it down a little bit more, again, 2017 to 2023. Breaks down really health insurance, but the bigger thing is annual growth. So let's go to annual growth. What we see as, let's just go from 2022 to 2023, and this points it out. One of the interesting points, where is there the most amount of growth? Look at the private insurance growth here. It grew 11.5%. It's actually quite staggering. Even though if we go back to a COVID year, which was perhaps an anomaly, you see decreases largely perhaps because individuals weren't seeking health care. But you can see the staggering growth here especially in private insurance. It's really tells a story now, driven by demand and demand of individuals who are using that private insurance. Now, that is purely private insurance. I'm sorry, is that private? Yes. Private, it does include individuals over 65 and lower income as well. Let's go a little further to look at the conclusion. I tend to go to the conclusion almost first in these to look at the overall trends. And you can see this really it doesn't a year-to-year comparison, but because um, we had such an anomaly in 2020, they tend to go back and forth. I'd like you to take a look at just before the conclusion, the summaries for retail pharmacy, for Medicare, Medicaid, private insurance, to have an understanding nationally of at least where we are in terms of what is being spent. So this is a big picture. We are not drilling down into individual communities or states. We're sometimes drilling down a little bit to inpatient versus outpatient versus long-term care, but it's much bigger than that. I usually go to the last line here. Of course, we're pretty uncertain about the future, but the drivers and what we're spending right now definitely are pointing out that healthcare will account for a larger share of the economy in terms of what is being spent. Now, I want to leave you with this first article with this comment from one of my um, favorite economists, David Cutler, who is famous of quoting that um, if the value that we are receiving equals the expense that we are attributing, then we're coming out ahead. The challenge is if we are spending um, more money on healthcare as a larger share of the overall economy, but as a population, not as individuals, as a population, we are questioning the value. How do we attribute the value? Health outcomes, overall access to health insurance. We saw the numbers of uninsured, fluctuations in terms of how individuals become or lose their insurance based on situations. And of course, affordability. The bigger question is not even so much in my mind, what are we spending on healthcare, but are we getting the value? This is as a nation. It becomes a little more challenging to drill down to the individual, but you can do that yourself. My sense is everyone listen to this understands a little bit how some more than others, what you are paying or what someone else is paying, at least for the cost of your health care. And quite honestly, if you don't go see a healthcare provider and nothing happens to you in a calendar year, that's probably good for you. Tends to be better for the health insurance system because that's how they make their money. So value really becomes the key question when it comes to expenses or costs. So I want to stop sharing for this, excuse me, and as you go to the Narrative Matters article. Matters is a wonderful short personal piece that is included in Health Affairs. It's always written by one or two individuals. It's a story, it's a narrative. This happens to be written by one of the leading health economists in the nation, who's, I think, retired now, about his own experience becoming a cancer patient. Um, and certainly it's a interesting and strange and tragic story. Um, but at the end of the day, of course, he's very open, saying that, he has great insurance and personal private insurance. And so he can also afford all of the costs associated with it. What's the most compelling part of this is not even so much the costs or his own experience, but this notion of what it means to be a consumer of healthcare. Let me try this. And because consumerism aligns with expenses and costs. The idea of a consumer means that we are all consumers in our own lives. We can make decisions about what we purchase, what we don't purchase. We can evaluate certain things, whether it be the purchase of a vehicle or the cost of your education for doing this. As I am recording this, our friends at Amazon are having big sales this week, and we are being pounded through our devices or ads in terms of reduction and savings. Well, I mean, we are certainly consumers in that respect, but in healthcare, this becomes really challenging. Um, the healthcare institutions and insurance companies do not have Prime days, at least not to my knowledge. And so this then becomes almost impossible. He gets into a little bit more in terms of then how we judge it, how consumers, who users judge providers and healthcare institutions, and in a very different way that we're able to judge a product that we purchase or a service at a restaurant or even the service you believe you should be getting and are getting in this educational endeavor. This is the other part to costs and expenses of healthcare. What does it really mean to the user? And that's something that I'd like you to ask yourself almost every week as you are going through the content. Um, what does it mean to the user, to the individuals who don't know anything about healthcare but have to use the healthcare system? Sometimes, and some people more than others. That is going to become the focus of what I'm hoping you get out of this class in all of the different areas. Okay, I'm going to stop. Please make sure that you understand both of the articles. The quiz is based on the two articles. And let me know if you have any questions. Otherwise, I'll see you on Blackboard. Okay, bye.